All right, welcome. Hello, everyone, to the Parkinson's Foundation Mind, Mood, and Motion. My name is Erin McGee. I'm Community Program Manager for the Minnesota and Dakotas chapter. Thank you so much for joining us today with Dr. Erin Holker presenting on Mind, Mood, and Motion. This program will be recorded and available for viewing from our website. We would like to know who is watching our program today. We're going to launch a poll, and please take a moment to answer what your connection to Parkinson's is. And we'll wait just a few minutes to allow everyone to answer. Wow, it looks like we have a variety of people with Parkinson's and spouses and partners. So thank you everyone for joining us. Again, if you need any assistance, please let us know by clicking the chat icon and we will help you out. Next, I'd like to thank our sponsors for today's program: Acadia Pharmaceuticals, Accorda Therapeutics, Amneal, Kiowa Kirin. During this time of social isolation, we hope that you are able to stay healthy and safe at home. The Parkinson's Foundation hosts virtual events each Monday, Wednesday, and Friday. To learn more and to register, please visit parkinson.org/pdhealth. You can also visit this page to view all of our archived PD Health at Home programs. Before we get started, I would like to share just a little bit of information about the foundation. The mission of the Parkinson's Foundation is to make lives better for people living with Parkinson's disease by improving care and advancing research today until there is a tomorrow without the disease. In everything we do, we build on the energy, experience, and passion of the global Parkinson's community. We provide free resources, including our website, parkinson.org, educational book series, webinars, podcasts, and our hospital safety kit called the Aware and Care Kit. We also have a great toll-free helpline at 1-800-4PD-INFO, which is staffed by Parkinson's specialists. We invest more than $10 million annually to support the most talented minds in research to explore what causes Parkinson's, how to treat it, and ultimately how to cure it. We recently launched a very exciting initiative called PD Generation, which provides free genetic testing and counseling to those with a Parkinson's diagnosis. To learn more and get further information, please visit parkinson.org/PDGeneration. And lastly, one of my favorite things is we bring local communities together through Moving Day, a Walk for Parkinson's, a national grassroots event that's raised nearly $27 million to support Parkinson's research and local wellness programs across the country. For more information, visit movingday.org. And with that, it's my pleasure to introduce our speaker today. Dr. Erin Holker is a clinical psychologist and neuropsychologist at mHealth Fairview and clinical core co-investigator through the Udall Center of Excellence in Parkinson's Disease Research at the University of Minnesota. She is the Division Director of Adult Neuropsychology and Associate Professor in the Department of Rehabilitation Medicine. So in short, she knows exactly what she's talking about. She has lots of expertise. If you have any questions for Dr. Holker through our presentation, please go ahead and click the chat icon and we'll address those in our Q&A session. Thank you for joining us, Dr. Holker. I'll let you take it from here.
Thank you, and thanks for inviting me. I always love giving these kinds of talks, and I'm not as used to doing it to an audience on Zoom. I like to be able to see people while I'm talking to them, so I do like it that you have on your, that a lot of you have on your video so I can see, but we'll have a chance to interact at the end, and if you have questions, I'm more than happy to answer them. I'm going to share my screen here. There we go. Can you all see that? All right. Yeah, okay. So I'm going to be talking about thinking, mood, and exercise in Parkinson's disease and how they all kind of go together, and hopefully give you some information that you haven't thought about before and some ideas about things that you can do to kind of help with your quality of life. Just a quick aside, Erin already mentioned I have some support through NIH, NANDS, the Udall Center, which is at the University of Minnesota. I am the neuropsychologist at the Udall Center. I also serve on the board of the American Parkinson's Disease Association. We're going to be talking today about a variety of things. We're going to be talking about just first of all, what is Parkinson's disease? Who tends to get Parkinson's disease? When do they tend to develop the symptoms? What does it look like in the brain? But then we'll spend most of the time talking about the cognitive changes that can happen during Parkinson's disease, what sorts of things to look for, when in the course of the disease they might happen, what to do about them. We'll talk about mood and about exercise and how that affects thinking as well. Oops, let's see here. Okay, so what is Parkinson's disease? Just very briefly, it was first described as a shaking palsy back in 1817 by James Parkinson, hence the name Parkinson's disease. It's the second most common neurodegenerative disease behind Alzheimer's disease, which is the most common one. The older people get, the more common it is. So about 1% to 2% of people who are 60 years or older will develop Parkinson's disease, but 3 to 5% of people who are over 80 years old will develop Parkinson's disease. There are more than 5 million people across the world who have been diagnosed with Parkinson's disease. It's slightly more common in men than it is in women. And we know that it's underdiagnosed in minority populations for a variety of reasons. So we think that it's more common than what we have seen so far in minority populations. We don't really know, we know some things that can increase the risk of Parkinson's disease, but we don't necessarily know what exactly might cause it. There's certainly maybe a genetic factor, and there may be some environmental factors. We know that pesticide exposure can increase risk. There's some research that shows that caffeine, cigarette smoking, don't start smoking, but smoking cigarettes, use of NSAIDs, and even gout might decrease the risk of Parkinson's disease. But these are correlational. We don't know really what exactly the connection is there. We just know that there's a little bit less risk. So looking at the pathology, I'm not going to spend very much time on this, but just so you have a general sense of how this works, Parkinson's disease is associated with the loss of dopamine-producing neurons that are in the substantia nigra. That's just an area of essentially your brainstem. It's in the very back of your brain, kind of deep inside. And when you lose the dopamine-producing neurons in that area, then you may develop symptoms of Parkinson's. It's associated with the buildup of these proteins. You may have heard of alpha-synucleins or synucleinopathies, but they're just misfolded proteins that can develop in that area of the brain, or they may spread out to more areas of the brain, what we call the cortex. And when that happens, you're more likely to see broader problems like problems with thinking, and we'll actually talk a little bit more about that. But Parkinson's disease is a Lewy body disease because it has to do with this accumulation of these proteins that are misfolded. There's actually quite a lot that's going on in your brain, that is happening in your brain before you start experiencing the symptoms of Parkinson's disease. There seems to be, you can have 70% of cell loss in this area before you even notice the symptoms. This might be one of the reasons that there are a couple of things that can happen many years before you actually are diagnosed with Parkinson's disease, and I'll talk a little bit about them, but there are some sleep disorders that may happen 10, 20 years before Parkinson's disease. That may be that some of the cell loss was starting back then, but the actual symptoms of Parkinson's don't happen until later. So the same circuits, we talked about the substantia nigra, they're part of the basal ganglia, which is that area deep in your brain. I don't know if you can you see my cursor when okay, so the basal ganglia down here have connections to different areas of the brain, and when you have cell loss and problems in these areas, it affects the circuits that run, the connections that run from this deep area of the brain to the front area of the brain and kind of up around here. There are motor circuits or motor connections, which actually cause the motor symptoms of Parkinson's disease, like slowed movements and the tremor and rigidity, those kinds of things. But there are also circuits or pathways that run right along those motor circuits that, that connect with areas of the brain that have to do with thinking and other aspects of non-motor symptoms, which I'll talk about in a minute. And so, so those same pathways cause motor symptoms that also cause the non-motor symptoms. So what are the non-motor symptoms of Parkinson's disease? Here's a list. It's not necessarily exhaustive, but it has most of the non-motor symptoms. Loss of smell, often one of the very first things that people will notice. That's a non-motor symptom. Sleep problems, I already mentioned, things like acting out your dreams. Sometimes people look like they're running or kicking or punching. We call that REM sleep behavior disorder. That can happen with Parkinson's disease, along with some other sleep disturbances. Autonomic problems, constipation, sometimes issues with incontinence, and that sort of thing, fatigue, pain and sensory changes, skin changes. And then there are also non-motor symptoms that affect things like mood, so depression, anxiety, apathy, I'm going to talk more about that, impulse control, things like compulsive gambling or compulsive sexual behaviors or compulsive shopping or compulsive focus on your Parkinson's medications. That in itself can be a problem. And then other non-motor symptoms or cognitive changes, which may be mild or maybe more significant, constituting dementia, which I'll talk about. Hallucinations, usually visual hallucinations, and delusions can happen as well. So I'm gonna just let's do a quick poll, and I'll just point out, in case you weren't aware, these are, this is anonymous, so so don't worry about, we don't know who is answering these, but I'm just curious to see how many of you have experienced one or more of these symptoms. We'll just give you a few more seconds to answer. This doesn't have to be, it's not a scientific poll, so just kind of curious. Just a couple more seconds. We've got a lot of answers here. I can tell you I'm already seeing pretty much every one of these. Somebody has, at least, actually several people have checked almost all of these. I'll just say autonomic dysfunction, that's things like, it can be like urinary incontinence, problems with regulating things like blood pressure and that sort of thing. I'm just seeing that nobody answered that, but that's probably because I didn't explain it very well. So we have a lot of people who have experienced really every single one of these. There's not one of them. The only one, again, that nobody checked was autonomic dysfunction, but everyone else, at least 2 people, but most of them several people checked. Loss of smell, very common, sleep disturbances, and fatigue, most common, but a lot of people checked other, like mood, impulse control disorders, cognitive changes, hallucinations. We run the gamut here. And so these are things, I think this is, it's helpful to see that, pretty much all of you are acknowledging or noticing some of these symptoms, because not all of them are talked about with your doctors. And your doctors may not bring up all of these when you go in to talk with them. And I think it's helpful for you to know that they're really common with Parkinson's disease, and there's often something that can be done to help these symptoms. And so if your doctor doesn't bring them up, you should bring them up with your doctor, and or I'll give you some other ideas about things that you can do about them. But just know that these are just like the motor symptoms, the tremor, rigidity, bradykinesia, just like those are really common. These are quite common as well with Parkinson's. So I'm going to switch gears and talk a little bit kind of specifically about cognition in Parkinson's disease. You can have anywhere from very minor, subtle cognitive changes to really significant cognitive changes with Parkinson's disease, which really means dementia, problems with memory and other areas of thinking that really are affecting your ability to manage in everyday life. And we'll talk about that. But the more common kinds of cognitive problems that many people with Parkinson's will experience are much more mild, but still bothersome. They may start with, we've got this technical term here, bradyphrenia, but I think it's good to put that, I think it's good for you to see that word, because you probably have heard the word bradykinesia, which means slowed movements. Very common, one of the most common symptoms with Parkinson's, motor symptoms with Parkinson's disease. But you also get bradyphrenia, which means slowed thinking. So your thinking tends to slow down just like your movements do. And that can happen without really any other major cognitive problems. Then there could be a little bit more significant cognitive changes, which we call mild cognitive impairment, kind of moving into dementia. So what are the areas that are most often affected with thinking? There are specific areas, there are certain patterns that we tend to see with Parkinson's disease because of the areas that are affected, where I pointed out before, you've got the subcortical, the deep subcortical areas of the brain that are affected, and then those connections to the frontal lobe. So the subcortical and frontal systems connect together and cause very specific kinds of thinking problems. These are, it is possible to have problems in one area that we've got listed here. It's possible to have problems in many areas, any combination of these problems, but these are the types of issues that we see. I'm going to go through each of these instead of reading them right now. I'll go through them. So attention and working memory, really common with Parkinson's disease. It's a lot harder to keep track of a lot of different things all at once. And so you may find that you really just have to do one thing at a time. And if there's any kind of interruption, it may be harder to screen out whatever the interruptions are and stay focused on what you're doing. That's very common with Parkinson's disease. Just multitasking, much more difficult. Executive functioning is very commonly affected. I think we tried to take out animations here, but there we go. So executive functioning overlaps with attention and working memory because you can think of multitasking as executive functioning, but really executive functioning is higher order thinking, things like decision making, planning, organization, being able to prioritize and think ahead and kind of plan, kind of think a few steps ahead. And plan things. That gets much harder. That's often when I see people with Parkinson's disease and they aren't noticing a lot of cognitive difficulties, but they are noticing a little. Often it's these sorts of things that they're noticing. It's just harder to keep track of a lot of things and keep on top of all of them and plan out how to do them. Problem solving gets more difficult. But also going along with executive functioning, it can be harder to initiate tasks. And so you may know exactly what you want to do. You may have a plan of what you want to do, but it's hard to get going with it. We actually see there's the correlation with that in motor functioning is that it can be hard to initiate steps. Actually, you may notice that where in order to start moving, you may have trouble just getting that first step going. That we see the same thing with thinking too, that just initiating a task or a thought even. Memory is affected in a really specific way. If it's affected in Parkinson's disease, it's affected in a very specific way. It's short-term memory that seems to be affected, but it's a specific type of short-term memory. People tend to have difficulty retrieving information. So if you hear something, you may learn it, you may have heard it and remember it, but then a while later you may have trouble calling it up unless somebody gives you a cue or a reminder. You might need some extra kind of reminders. So it's difficulty just retrieving without that extra cue. This is different from something like Parkinson's disease, from something like Alzheimer's disease, where there's a problem with retention, which means that no amount of cues or reminders is going to call that memory back up for you. It's just not there anymore. And so, so it's a very different type of memory. And from my perspective as a neuropsychologist, I want to know what type of memory problem you're having, because it helps me figure out what area of your brain is affected. If it's that frontal and subcortical area, then we know we're going to see retrieval problems, and that's really related to the Parkinson's disease. But if you're completely forgetting, it's like it never happened, no amount of reminders is gonna help you, then we think there's a different area of your brain. We call it the mesial temporal lobe. We think that area of your brain might be affected, and that leads us to think there might also be something else going on, like Alzheimer's disease. Word finding is probably the most common language difficulty that people will notice with Parkinson's disease. I will say that word finding is something that gets worse as we get older. So, so to a certain extent, it's just kind of normal to have some trouble with word retrieval. But this kind of word retrieval is a little bit beyond what we would expect just from normal aging. And it's just trouble finding the right words. It might be the same issue with memory, where if you get a cue, like the word starts with the sound, whatever it starts with, or it sounds like this, that might be enough to jog your memory and to come up with the word. But a lot of times people will find themselves kind of working around what they're trying to say and coming up with other words because they have trouble with word retrieval. Visual processing can be affected. So that's being able to look at something and make sense of it. So sometimes sense of direction can be impaired. People might get lost in places that they know really well. It could be their neighborhood. It could be their own home. Sometimes people get turned around in their home and don't know where the bathroom is or the kitchen. That can sometimes happen with this visual processing difficulty. People can misjudge distances, so they may reach out for something on the table and miss it because they may run into doorways as they're walking through them. They may notice that they're having more trouble navigating in places that they've never been before. So, so really, we're interested in a change. Some people just always have had trouble navigating. But if you suddenly are noticing, or over time, if you're noticing that it's harder to kind of figure out how to get somewhere new, that might be some difficulty with this visual, spatial, or visual processing. I talked about bradyphrenia, the slowed thinking. So it might take longer to process information, to think through it. It might take, so tasks that would normally be pretty quick can take much longer, not just because you're moving more slowly, but because you have to think through step by step how to do things. And it also might take longer to just actually, it's this initiation thing again. It might take longer. You might be thinking about something, but it takes longer to actually move and to do it, to translate that thought into actions. That's a common issue with Parkinson's disease. So I just kind of went through all of the different, we call them cognitive domains, that can be affected with Parkinson's disease. And like I said, those can be affected. Maybe one of those cognitive domains can be affected, maybe several, but it could be mild. It is possible to have more significant cognitive decline with Parkinson's disease that actually meets the criteria for dementia. Dementia is an overarching term, so kind of stepping back from Parkinson's disease, just looking broadly at dementia, it's really the definition of dementia is a decline in more than one area of thinking. It might be memory, but it doesn't have to be memory. It also could be things like reasoning, problem solving, language abilities, visual processing, being able to interact interpersonally with people. So declines in one or more areas of those one or more of those areas that also interferes with your ability to do things in everyday life, like manage your finances or manage your medications or drive, those sorts of things. It needs to be the problems with thinking or social behaviors that are interfering with your activities of daily living, not motor problems only. So if you're just having problems doing your finances because it's really hard to write out checks, that's not a reason to diagnose dementia. But if you're forgetting to pay your bills, so you're not writing out your checks, that's more of a concern. So that's an overarching definition of dementia. The most common cause of dementia is Alzheimer's disease. So Alzheimer's disease is one type of dementia. It gets more and more common as people get older. But another type of dementia is Parkinson's, is a dementia associated with Parkinson's disease. A large number of people, not everybody, but if the longer people have Parkinson's disease, the more likely as they get older that they'll develop dementia at some point. It could be very late in the disease, but because you're aging and you're a person, you're also at greater risk as you get older of developing Alzheimer's disease, which can be separate. It may be unrelated to the Parkinson's disease. So it's possible to have Parkinson's disease without dementia, but then also develop Alzheimer's disease. Again, this is one of the reasons why it's helpful to have an evaluation, like with a neuropsychologist, to sort out what exactly the cognitive problems are that can, and that pattern of performance can help to figure out what might be going on if you're having memory problems. Let's see, I don't think I'm going to go into too much detail about this slide, except to say that that with dementia with Parkinson's disease, you're likely to have problems in all of those areas that I was describing earlier with executive functioning, visual processing, attention, memory. Probably also will have some more significant hallucinations and some mood kind of changes. There is a higher risk of developing dementia as we get older. The worse the motor symptoms are, the more likely the person is to develop dementia. Interestingly, people who have tremor as their predominant symptoms with Parkinson's disease are actually a little bit less likely to develop very significant cognitive problems. So, so more tremor may mean less cognitive difficulty. The more, if your Parkinson's shows up more as the akinetic, rigid type, then you're a little bit more at risk for developing dementia. The more symmetrical the motor symptoms of the Parkinsonism, so the more equal the symptoms are on both sides of the body, the more likely you are to have thinking problems. This may be because it's more of an atypical kind of Parkinson's disease. Most people with just sort of straightforward Parkinson's disease will have one side affected more than the other, especially towards the beginning. And the more symmetrical it is, just the more likely there will be some cognitive problems. People who develop hallucinations, usually visual hallucinations, are going to be at greater risk. That tends to be associated with more cognitive difficulties. And people who experience significant depression are at greater risk for developing dementia with Parkinson's disease. Talking about hallucinations a little bit, about 20 or 30% of people with Parkinson's disease might have hallucinations at some point. Usually they happen later in the disease. If they happen earlier, it may mean that something else is, it's not kind of what I was saying is the straightforward kind of Parkinson's disease, or there could be medications that could be contributing. The visual hallucinations tend to be very realistic. So it often looks like a person is in the room with you. It might look like an animal. It could be, sometimes it's a misperception where there's a blanket and you think it's a cat, for instance, or a dog. Sometimes it's really a true hallucination where there is nothing there that you're misperceiving. It just looks like a person is there. It's unusual for people to hear very much. Sometimes, so to have auditory hallucinations or hearing voices, sometimes people will hear like what might sound like a radio in the other room, or music playing in another room, but it's not that common for if a person sees someone who's standing there who's not actually there. Usually that person won't talk, they won't interact with the person. I talked about misperceptions or illusions. Sometimes, actually not uncommonly, I hear people who with Parkinson's disease talking about just the sense that there's someone behind you or off to the side. Sometimes I hear people describing, it looks like there's a mouse running in the, or a cat running by in the peripheral vision, but when they actually look, there's nothing there. That's pretty common. That is not uncommon in my experience with people with Parkinson's disease. And we call those more kind of simple hallucinations, but more complex hallucinations, like I said, can be very well formed, well detailed. Things like animals or people where you can look right at the person or right at what you think is the person and you think that they're there. You can see every detail on their face and their clothing and that sort of thing. Usually people know that they're not real. Sometimes it takes a little bit of convincing, or it's not noticed right away that you think that somebody is actually there. These can be very frightening, but they also can be like not a big deal. And we actually don't necessarily recommend, there are some medications that can help, but if it's not frightening and it's not very bothersome, it may not be worth taking medications for these. Just be aware that it's a symptom of Parkinson's. So there are some other factors that can contribute to thinking problems and mood issues. Medications can affect, so medications that you take for Parkinson's disease, medications that you take for other things, sometimes people can be more sensitive to them if they have Parkinson's disease, so they're more likely to have other symptoms like mood issues or thinking problems. Sleep problems. I mentioned this REM sleep behavior disorder. Other kinds of sleep disorders can happen with Parkinson's disease. If you're not getting good, restful, restorative sleep, that can affect your thinking and your mood during the day. And so it's really important to discuss those problems with your care providers if you're having them. So because often that's one of the things that can be treated, and then you get some real benefit. Your thinking can get much better and your mood can improve during the day. Fatigue is the same thing. If you're feeling fatigued or stressed, that can affect your thinking. Infections. So everybody, whether you have Parkinson's disease or not, if you have an infection like pneumonia or urinary tract infection, it can affect your brain functioning. But if you have something like Parkinson's disease, you're actually at much higher risk for that having a significant effect on your thinking. You're more likely to have what we call a delirium or an acute confusional state, where your brain is essentially busy fighting off the infection, so it's not working very well as far as your thinking goes. You can get more confused, more disoriented. Hallucinations are much more common when people have infections. And so that can be frightening. Usually that gets better as the infection is treated. And so, but it's really important to take that seriously because that can have serious negative effects if it's not treated. So make sure that if you develop an infection like a urinary tract infection, you take it seriously. I'm going to just briefly talk about what a neuropsychological evaluation is, because I like to put in a plug for, for neuropsych testing and neuropsychological evaluations. We're looking at brain functioning with these evaluations. We're doing kind of an objective assessment of thinking. So memory, attention and concentration, problem solving, language abilities, all of these different things that I'm talking about. But we also we're looking very broadly at how a person is functioning. So not just their thinking, but also things like mood and sleep, medications, pain. We look to see how active people are, because we're really trying to see overall, what are the things that could be affecting your thinking, and what are the next steps? What are the things that we can do about it? We're looking, when we do these kinds of evaluations, we're looking to see the patterns of strengths and weaknesses that people experience, because like I was pointing out before, the pattern that we see can help point to areas of the brain that might be affected, which then helps us figure out what all might be contributing. So is this something that's related to Parkinson's disease? Could it be some other process that's going on as well? And then what are your strengths, so that we can make recommendations about how to compensate for any of the weaknesses that you might have. This kind of evaluation is helpful at baseline. So we often will see people fairly soon after diagnosis, just to get that baseline, and so we can make comparisons in the future. And like I said, it's not just looking to see if there are cognitive problems, but also looking to see what could be contributing to any problems with thinking, so that we can address those as quickly as possible. What usually will come of an evaluation like this is figuring out next steps, like, will it help to see a speech therapist or do some cognitive rehabilitation? Are there things that you need to be talking with your neurologist that you haven't talked about yet? Are there medication issues that need to be discussed? So kind of figuring out next steps. Let's see, I did just actually mention some of these things, but when people have concerns about changes in cognition, we always want to kind of first rule out things that could cause those problems, like sleep problems or medications or infections, those sorts of things. We want to look at your doctors will want to look at your medications, and some of the medications that you take might be worsening thinking. So there are some times when they may want to take you off of those, wean you off of those medications. Sometimes it's worth it to stay on the medications because you're getting good benefit to your for your Parkinsonism, for the Parkinson's symptoms. And so it's a matter of working with your doctor to figure out what makes the most sense. Sometimes it's possible just to simplify the medication regimen, even not even necessarily changing the medications, but changing the times that you're taking them or the frequency, and that can help to address some of the motor and cognitive difficulties. But then more generally, the more structured of an environment you have, the better people tend to do, especially with the types of problems that we see with Parkinson's disease. So we always recommend having a nice routine. You do not have to do the same thing every day, but the things that you do every day, like waking up and going to sleep and taking your medications and eating your meals, those things that happen every day, it's helpful to try to do them at the same time every day. And so you have just sort of a skeleton of a routine that you can maintain. And that actually can help quite a bit with things like problem solving, with these executive functions that we're talking about, and attention and memory. The more routine you can keep some of those things, the better it can be. So having a schedule that's similar every day, it may be different for you than it is for someone else, but whatever works for you, just trying to maintain that consistency can be helpful. You can work with a speech therapist or somebody who does cognitive rehabilitation to directly address some of the cognitive changes that we see. I'm going to come back to that in just a minute. We'll talk a little bit more about that. There are some medications that can be prescribed to help with thinking. They don't usually prescribe them if you're just having subtle problems with thinking, but if there are more significant concerns about true declines that look like they may be at least what we would describe as mild cognitive impairment or maybe dementia, then they may be more likely to prescribe things like Aricept, which was developed for Alzheimer's disease, but can work well with Parkinson's disease, or some other medications. There are some specific medications that are sometimes prescribed with Parkinson's disease to help with hallucinations and delusions. And I mentioned before, they don't always recommend prescribing medications to address these issues. It really depends on, for the individual person, how much of a problem it's causing for them. If it's not very disturbing, it may not be worth medicating. And sometimes it's more disturbing for family members than it is for the person who's experiencing them. So if it's not frightening or causing problems with the person who's experiencing them, it may not be worth adding a medication. Sometimes it's actually a matter of reducing medications, taking you off of some medications. Medications are not my area of expertise. I recommend talking, first of all, to your neurologist, but I also recommend nowadays, it's not that hard to find a pharmacist who does medication therapy management, where they have specialties. They understand, it's especially nice to talk to somebody who really understands Parkinson's disease, because there are so many different medications that people take for Parkinson's disease and so many different ways to take them, that it's nice to have somebody who can go through every medication and look to see how it interacts with the other ones and make recommendations for you that's really tailored to you as far as medication go. So if you haven't had that, that might be worth talking to your neurologist about whether they have that available where you are. You might go through, there's some research that shows that cognitive training can be helpful just in general for problems with thinking. This is a little bit sort of controversial. We know that regular guided practice on standard tasks can help with particular aspects of cognitive functioning, don't necessarily generalize to kind of all areas of cognitive functioning, but there are things that you can learn that can really help. So strategies that you can learn that can really help with thinking. It's best to have individualized sessions with a specialist. Usually this is going to be an occupation, they'll either be called an occupational therapist or a speech therapist. Those are the people who tend to do cognitive rehabilitation. And so they're trained specifically in working with you on what your specific concerns are. Often they'll take the information from a neuropsychological evaluation, so they know what your strengths and weaknesses are, and they'll come up with specific strategies to address the problems that you're having. So if you're having trouble managing your medications, they may be able to help you come up with strategies for that. Or if you're having trouble just staying focused while you're doing things, they can help with attentional, things that can help with attention. What we know is that people often ask about these kind of computerized. There are some online things that you can do that can that say that they're to help with brain functioning. The jury is still out on those things that are not individually tailored to you, where you're actually working with a professional. They may help. What we know so far is that they don't necessarily tend to generalize. So with those online kinds of brain training things that you do, you may get better at what you're doing online during the brain training exercises, but that may not mean that you're going to get better in everyday life, being able to do your kind of normal tasks. And so we really recommend more individualized, tailored kind of recommendations. There are some things that you can do to help with thinking problems. So very low-tech things. We often recommend that people put like a basket or a box in a place like maybe by your front door, where as soon as you walk in, you throw your keys in there, you throw your wallet in there. If you have one place where you keep things all of the time, where you keep specific things all of the time, then if you can't find it, you go back to that place. That's the first place you look. And the more you do that, the more it develops into a habit, and the less likely you are to just drop those things like your keys or your glasses or your wallet just anywhere in the house. So just find a place that you could, an easy place where you could do that. We have sticky notes written on here I'm actually I don't love sticky notes because actually I use them. I've got like whole bunches of them right here. So I do use them. But the problem with them is that if you use too many of them and put them up all over the place, you may not remember to look at them. And so the more you have, the less organized it becomes. And we already know that organizational difficulties can be a problem for people with Parkinson's disease. So they're helpful in certain circumstances. And, you know, sometimes people think, well, if I put a note up at the door that tells me to remember to, you know, grab my glasses before I leave, that's nice the first couple of times that you're going out the door, but you tend to get used to seeing it there and then you start forgetting again. So it's not necessarily going to generalize. You might actually, what might be helpful is to move it every day, every couple of days, just move that note somewhere else. So it's a little bit different, and that might help to pay attention. But I actually recommend, if you're trying to keep track of things, it's probably better to have a place where you keep information, like a central notebook, or these days, if you have a smartphone or an iPad, you know, a device of some sort, writing it all and keeping it all in that place, and even setting reminders, that might be more helpful. There are pillboxes with built-in alarms these days. Not only are there pillboxes with built-in alarms, but there are apps that you can use. Actually, I think that might be sort of on my next slide here. There are actually apps you can use for medications that can remind you when to take your medications, but there are even apps that will connect your family members to your medication regimen, if you, and that can sometimes help people stay independent longer. If a family member gets an alarm about the medication, they can make sure they can call or do whatever they need to do to help make sure that you've remembered to take them. But set alarms, those are really useful. It's so much easier now that most of us have a little kind of computer in our pockets. If you've got a smartphone or some kind of a device, there's lots of different apps and other things that you can use to help remind you to do things. And now just a little bit of talk about exercise, and then we'll kind of open it up for discussion. It's hard to stress how exercise is really important for your brain functioning. This is true for people who have Parkinson's disease and people who don't have Parkinson's disease. We know that exercise improves heart and lung function, and when you have improved heart and lung function, your motor functioning gets better, attention gets better, your processing speed, your thinking gets better. We know that just kind of in general, aerobic exercise just in healthy older adults improves specifically things like attention and executive functioning and memory. Similar balance can actually get better for people with Alzheimer's disease. Memory can actually get better with exercise. Processing speed and kind of complex attention can get better in people with depression who exercise. With those benefits, and you get benefits to your motor functioning as well. There's research that shows that any kind of exercise with Parkinson's disease is helpful, but there's specific research that looks at things like yoga and biking and boxing, Tai Chi, Nordic walking with the sticks, tango. These are all things that there has actually been actual research with people with Parkinson's disease that shows that there's benefit to movement, and there's benefit to balance, and there's benefits to your thinking and to mood, and to sleep. So you get a lot of bang for your buck with exercise. Looking at kind of animal models of how exercise affects the brain. It's kind of interesting that animals who have been forced to exercise actually do better on cognitive tasks than animals that have been sedentary or have not moved very much. Long-term running exercises increases the growth of neurons. The hippocampus is the area that it's the temporal lobe more affected in something like Alzheimer's disease, but we all need our hippocampus. It is really important for memory. And so that long-term kind of aerobic exercise can help with growth of neurons in the hippocampus, and it will release brain factors that actually create additional synapses in the brain. So there's direct evidence of exercise having a specific effect on how the brain, on the structure and function of the brain. increases in this brain factor in both healthy adults and in people with Parkinson's disease can lead to these specific improvements that are listed here. So if you have moderate intensity exercise, 45 to 60 minutes, 3 times a week, we know that your executive functioning tends to improve. If you add resistance exercises and strength training, 60 to 90 minutes twice a week, then we know specifically that working memory, executive functioning, and attention improve. The more, if you do high intensity kind of treadmill exercise, you can have, like, if you have more high intensity exercise, you're more likely to get kind of more benefit to it. It actually seems to be neuroprotective. That's a big thing to keep in mind, is that it's actually, it actually has a protective effect for people with Parkinson's disease. They are less likely to have significant cognitive decline after an extended period of time, and they're more likely to have a positive effect on mood. Actually, I'm just going to skip through this and go to this next slide, because I think this is the take-home message for that. Try to get some real exercise every week. So they really recommend about 150 minutes total of exercise, enough exercise so that your heart rate is elevated and that you sweat. It can't just be like a kind of a simple walk, but so you have to get that much exercise. You should be getting enough exercise that you're feeling a little bit fatigued, but not exhausted. It should not be overwhelming. You definitely shouldn't be experiencing pain. I'll say that this is a little harder now in the times of COVID. With gyms closed, I think some of the gyms are open now, but I'm not going back to my gym yet. I don't know, I'm sure a lot of you are not feeling comfortable yet going back to gyms. And so you have to find other ways to do this kind of exercise. And this is actually a plug. I can put a plug in for the Parkinson's Foundation has these online exercise programs. And I would recommend looking into those, because it gives you something to do at home where you are getting some kind of exercise. It's just important to really, whatever you can do is going to be helpful. Try to have it be more, try to have it be enough, again, so that it's raising your heart rate and that you're getting to the point of sweating. Any exercise is good for you. Okay, so kind of to summarize, Parkinson's disease is fairly common. There are specific problems with thinking that are fairly common with Parkinson's disease. They may be very mild. They may be more significant, but they usually, the general pattern usually affects things like problem solving and specific memory problems like retrieval difficulties and attention and visual processing. It is possible to have visual hallucinations in particular, and thinking can get, problems with thinking can get significant enough so that it's possible to have a dementia that goes with Parkinson's disease. You really should, if you have any sudden changes, you really should talk with your doctor right away, because we don't actually expect sudden changes in thinking with Parkinson's disease. We expect them to be more gradual changes over time. So anything sudden actually means something else is going on. You want to rule out the possibility of a stroke or medication problems or other kinds of, or infection that might be causing a delirium. Make sure you talk with your doctor right away. Cognitive rehabilitation can be helpful for specific kinds of things. There are strategies that you can put into place that can be helpful, and make sure that you exercise, because it really may have a positive effect on your motor functioning, on your thinking, on your mood, and just general quality of life. Make sure you, we've got this don't go it alone. Make sure you talk with you should hopefully have a whole team around you of people who are helping. So for sure your doctor, hopefully your neurologist, having maybe a mental health team, a psychologist or a psychiatrist, occupational therapist, speech therapist. There should be a lot of people around you who can help, plus all of your own, your family or friends who can do these things with you and maybe exercise with you and practice these together with you. And now I think I'll open it up for discussion if you have questions.
Great. Thank you so much, Dr. Holker. We do have a few questions.
Good.
All right. So first one, how can I get my spouse to consider medication for depression when he feels over-medicated already?
Okay.
And then what are, kind of a two-part question, and what are the warning signs that depression is worsening?
Okay. Okay. So first of all, ways to treat depression. Medications are one way to treat depression, and they can be a really helpful way to treat depression, but there are other things that, that you could consider, and it might be helpful if you're concerned about a spouse's depression. It might be helpful to talk with your doctor about some of those other options for managing depression as well. So obviously exercise, which I've just kind of emphasized, get moving, do some sort of activity, and exercise. That can be hard if you're very depressed because depression affects motivation. It's hard to get moving, but if you try to build that into your routine, a little bit of exercise and just kind of increase that, that can help with mood. Addressing other issues like sleep problems or any kind of pain that people are experiencing, that can actually help with depression as well. And then psychotherapy is a big one, particularly with people with Parkinson's disease. I didn't really stress this, but depression is extremely common with Parkinson's disease. It's maybe 50% or more of people who have Parkinson's disease will experience depression because of the area of the brain that's affected. It's a similar area of the brain that's affected with Parkinson's disease and depression. And so it can be really helpful. We know that the best treatment for depression really is a combination of medications and things like psychotherapy. And so we often recommend therapy with a health psychologist, which is somebody who specializes in, they really understand the effect of something like Parkinson's disease on your mental health. And you can learn strategies that can help to manage depression. You can just kind of get that extra support as well. So there are a lot of avenues that you can take that don't have to do with medications, and I'd recommend trying those if you're really worried about adding medications. But then sometimes it just makes sense to add the medications. Your quality of life might really improve if you're having trouble managing the depression in any other way. It really might be worth it to just try to have a trial. It can't be a brief trial. You usually have to be on these medications for a month or 6 weeks or so before you see much benefit. But sometimes people are more willing to try those things if they've tried some of these other things first, if they've tried exercise and addressing sleep issues and maybe tried psychotherapy. And then even the psychologist can talk to you about the benefits of medications, or just talk to your neurologist too. Signs that depression is worsening. So depression can show up in a lot of different ways. Some people like feeling down and mopey and sad and just can't get out of bed. Those can be symptoms of depression. But sometimes irritability is a symptom of depression. So you may not look at a person or interact with a person and think they're depressed, but they may be very irritable and on edge and just easily angered. That actually can be a symptom of depression, and tends to be maybe more common with men. And so that's something to look out for in a family member. Definitely changes in level of interest. If you've lost interest in things, you just don't feel like doing things anymore. If you have changes in motivation, changes in appetite, changes in sleep that haven't been kind of long-standing but are more sudden, all of those things are things to look out for depression. And I'll also add that common, unfortunately, with Parkinson's disease is apathy, which is really this just sort of lack of interest and excitement about things. Just things don't really matter all that much. It's hard to get yourself even things that you would normally enjoy very much, you just may not get very much enjoyment from them. Unfortunately, that can happen separate from depression. It is possible to have apathy, but not truly be depressed. It may look like depression, but it's really apathy. That is harder to treat. The depression is much more amenable to medications. You're much more likely to get benefit from medications. Apathy is harder, but you can do things like exercise, trying to be active, keeping your mind active. So engaging in activities, going to talks like this, doing those sorts of things, that can sometimes help with apathy as well.
Yeah, and I also feel like during these COVID times, we might see an increase of that, and maybe
Yes.
really important to mention that with your provider.
Absolutely. And so I think this is really important to mention is that, like I said, depression is really common with Parkinson's disease. It goes hand in hand, but then you add outside forces to that, and it's just much more likely, just for all of us, but people with Parkinson's disease in particular, to experience increases in stress and depression and anxiety when you're feeling more isolated, or you're worried about you're worried about getting the virus, or not being able to see your family members. Isolation is a major concern. That's why everybody who's here listening to this talk, you've been able to get onto your computer and watch this. So that means you're able to figure out. There are a lot of resources. The Parkinson's Foundation has a lot of resources. I'll just add APDA also has a lot of resources, but there's a lot of things that you can do online that can connect you with people, support groups you can do online, find ways to connect to people that you would not normally do. I've talked to a lot of people who have said they're picking up the phone way more now because they feel more comfortable on the phone. So they're just going through their address books and they're just calling old friends that they haven't talked to in a long time. And they're using this time as a way as a chance to reconnect with people in ways that they haven't really done before. And that might be helpful too for your mood as well.
Great, thank you. I have one other question as we're approaching our timeline. Just any other quick tips or best practices that you could share for someone experiencing memory issues, not just for the person with Parkinson's, but also for their spouse, partner, and family?
Yeah, so I think that in addition to all the things that we talked about, definitely talk with your doctor if you're noticing memory problems, because I think it's a good idea to get started on an evaluation and figuring out what all might be contributing to the memory problems. But then actual strategies to use. The big things are taking notes. Again, I like to have a central place to keep notes. I think that's a good idea, like a notebook or a large calendar where you keep things. Again, the problems with memory tend to be retrieval problems. So the memory is there, it's just hard to call it up. So just brief notes can be helpful. Just even 1 or 2 words to remind you of something. If you carry a small notebook with you or you use your smartphone, just little reminders can often go a long way. Just something that's going to kind of jog your memory and help you call it up again. Again, routine can really help because if you can kind of figure out where you are in the day and what you mean to be doing, that can help to kind of jog your memory as well. But kind of notes are the big thing, finding ways that work for you, that either family members providing you with lists or reminders, having somebody come with you to medical appointments, or get on, if you're doing remote visits now, get on the remote visit with you and have them take notes so that you can focus on what the doctor is saying or what the provider is saying. That can be really, or ask the provider to give you notes for the visit. That can be helpful as well.
I come prepared. I usually have notes on my cell phone because I can never remember when I get to the appointment what I want to talk about.
Right, I do the same thing. I make sure I write it all out.
Right.
I see somebody, Lori is raising their hand. I just want
to. Yes, I've communicated with her. I just did see, I missed a question. When we had, how can a member of the team, I'm thinking the healthcare professional team or your interdisciplinary team, help to encourage exercise in a person who has negative history with exercise, like body shaming or doesn't like to sweat?
Yes. So I think that's a great question, because some people come to it honestly, they love exercise. It's no big deal. They keep incorporating what they've always done. For some people, it's more difficult for them. There can be many different reasons why it could be difficult for them. I think that maybe the easiest answer to that is I would recommend starting off with a physical therapist. So ask your doctor if you need a referral to a physical therapist. Work with somebody who understands Parkinson's disease, and they will tailor your exercise regimen to you. So you can talk to them about what is difficult for you, what you feel uncomfortable with, but what makes you feel comfortable. What are the kinds of things that you feel just fine doing? And they'll tailor an exercise routine for you and help you work up to it. So you don't have to just all of a sudden start and be able to do it. The other thing is I would really encourage you to be willing to just try some different things. It's in some ways it's easier now because you can do classes online. When things open up again, there are things like boxing, which some people hate and some people love, but you won't know until you just give it a try. So even just going one time and just, trying to convince yourself to try these things one time now is actually easier again, because there are things you can do, yoga and other things that you can do online, and you try it out and see if you like it. But I would recommend for people who are very uncomfortable with it, I would start with a physical therapist, because they are going to have many ideas about what will work for you, and there's kind of endless options for exercises for you, and they'll know what they are and can get you started on that.
And just a quick follow-up, how do you find a physical therapist?
I think the easiest way is talk to your neurologist about it, because they are most likely to work with physical therapists who know about Parkinson's disease. So I think that's probably the quickest and easiest way to do that.
Great. Thank you so much, Dr. Erin Holker, for even going over a few minutes today and sharing your time, stepping away from the clinic and school so you could be with us today.
You're welcome.
All right, I just have a few things to share before we wrap up. And thank you to everyone for joining us as well today. If you have any other questions, I definitely recommend checking out our website at parkinson.org or calling our helpline 1-800-4PD-INFO. You'll talk to a real person, a Parkinson's specialist, who will help find resources and support for you and answer any questions. And then lastly, I'd love to have you join us. I'm working on doing a first Thursday of the month program. So today is the first Thursday of the month. So next month, October 1st, I'm excited to have a program called Ask the Experts, Questions and Answers with Dr. Tanya Harlow, a movement disorder specialist of Sanford Health in Fargo, North Dakota. So this will be a very similar setting where we come together as a group and just have a conversation with the doctor asking questions. So thank you again for joining us today. I hope you all stay safe and stay healthy.